like many physicians, I started very early in my interest. When I was a very little boy, my brothers and I, much to the consternation of several young girls in our neighborhood, operated on their dolls. It was playing doctor at that point. As time went on, my playmates and even into high school, if they had some little medical problem, something got stuck in them or whatever, they always came to me. And I was always able to fix them up. Luckily, to my memory, no one had to go to the hospital because of something I did. But it was just a natural sense of caring for people, wanting people to get better. The most rewarding part for me, so I'm a transplant doc, and the most exciting thing about what we do is that we take people who either are having a difficult position in life, people on dialysis, needing to go in for dialysis 3 times a week, not feeling so great after dialysis, and they get a kidney transplant and they return to feel pretty close to the way they felt when they were in perfect health, as long as they're taking their medications and so forth. I also get to take care of patients with heart transplants and liver transplants, lung transplants, and in those patients it's life-saving. We very often have problems with the kidney. Almost everyone is, when you get very, very sick, the kidney is one of the organs that is in trouble. So we get a chance to take care of those people where it's life-threatening. And it's wonderful to see them in a situation where it's life-threatening or life is not so great, and then you see them months later and they look like anyone else you'd see walking down the street. Whenever I see it, I'm amazed every time. The one question I wish my patients would ask more is, what else can I do to live a long, healthy life? So I primarily take care of transplant patients. The assumption is you take your medications, you come to the clinic. If there's a problem, you let us know about it early. But then that's just the fundamental beginning point. What I would want to hear from patients is, how do I get the most out of life? How do I get to live as long as I possibly can? How do I improve the quality of life? So a lot of those questions require more time. Do you exercise? What about weight loss? What about your spirituality? Those kinds of things. And some people are in a state of despair, and they come to us and they take their medications, they show up for the appointment, but intrinsically they're in a state of despair. No one knows it but them. And we don't want the minimum effect of patients in terms of the quality of their lives. How do I live to be 100? I mean, I would love it if patients ask me that question. How do I live to be 100, and how do I live to be a great 100? That's really what I would like to hear. I'm Dr. Jerry McCauley. My mission at Jefferson is to improve lives.